As we age, making smart dietary choices becomes more important than ever, especially when it comes to fruit. While most fruits are celebrated for their health benefits, star fruit is a dangerous exception for many seniors. This tropical fruit contains a compound called caramboxin, a neurotoxin that healthy kidneys can filter out. However, studies show that 1 in 3 older adults may have reduced kidney function without knowing it. When caramboxin builds up in the bloodstream, it can cause serious symptoms such as dizziness, confusion, vomiting, and in severe cases, seizures or even coma. One real-life case involved John, a 72-year-old man from Florida, who added star fruit to his smoothies, unaware of its risks. Within a week, he began experiencing memory lapses and fatigue, ultimately collapsing and being rushed to the hospital. Doctors discovered the star fruit had triggered severe neurotoxic effects due to his undiagnosed kidney condition. This isn't a rare occurrence. The National Kidney Foundation warns against star fruit consumption for anyone with impaired kidney function, diagnosed or not, because the symptoms can develop subtly and worsen over time. This fruit can be especially dangerous for seniors who already face complex health concerns. The good news is that safe and delicious alternatives exist. Instead of star fruit, seniors can opt for Asian pears, which are crisp and refreshing, or dragon fruit, which offers tropical flair without the health risks. These choices still satisfy cravings while supporting the body's needs in later life. Ultimately, staying informed about what we eat is an act of self-care. Choosing fruits that nourish, rather than harm, can help seniors maintain their independence, energy, and quality of life. If you're over 60 or care for someone who is, it may be time to take a closer look at what's in the fruit bowl. Grapes. The hidden danger for seniors. Grapes are often seen as a healthy, guilt-free snack, sweet, bite-sized, and refreshing, but for seniors, this seemingly innocent fruit can present serious health risks, especially for those managing diabetes, pre-diabetes, or swallowing difficulties. As we age, our metabolism slows and our bodies become more sensitive to sugars and textures that we once handled with ease. Grapes, while natural, are loaded with simple sugars and have a high glycemic index. Just 1 cup of grapes contains about as much sugar as 4 sugar cubes. This can lead to rapid spikes in blood sugar levels, which are particularly dangerous for older adults. Nearly 50% of Americans over 65 are managing some form of diabetes or insulin resistance. For them, a sudden blood sugar spike can cause fatigue, mood swings, dizziness, or even long-term complications such as vision loss or nerve damage. One woman, Patricia, a 68-year-old from Chicago, made the well-meaning switch from afternoon cookies to a bowl of grapes, thinking she was making a healthier choice. But within weeks, her blood sugar became unstable, her energy levels dropped, and her eyesight suffered. She was shocked to learn that grapes, something she had eaten her entire life, could have such a profound impact on her body. Beyond blood sugar, grapes pose another serious threat. They are a common choking hazard, especially among seniors. As we age, the muscles involved in swallowing weaken, making it easier for smooth, slippery foods like whole grapes to become lodged in the throat. In fact, choking incidents involving grapes among seniors have risen by 30% in the last 5 years. According to the National Safety Council, because they're small, round, and easily inhaled, grapes can block airways quickly, leading to panic or even suffocation if not cut or chewed properly. Thankfully, safer and healthier alternatives exist. If you love fruit, consider switching to berries, such as blueberries, raspberries, or strawberries. These are lower in sugar, higher in antioxidants, and easier to chew and digest. Berries support brain health, heart function, and blood sugar stability. Melon chunks are another good option, offering a juicy, refreshing taste with better portion control and lower sugar content. If grapes remain a favorite, moderation and preparation are key. Limit yourself to 6 grapes per serving, and cut them into quarters to reduce the risk of choking. You can also pair grapes with a protein source, like cheese or nuts, which helps slow the absorption of sugar and keeps blood sugar levels more stable. The key takeaway for seniors and caregivers alike is that not all fruits are created equal, especially in later life. Just because something is natural doesn't mean it's harmless. Paying attention to how fruits affect blood sugar, digestion, and safety can make a big difference in maintaining energy, preventing complications, and supporting overall well-being. Aging gracefully means making informed, thoughtful choices, starting with what's on your plate. Oranges. The acidic trap for seniors. Oranges have long been celebrated for their high vitamin C content and immune-boosting properties, making them a go-to fruit for people of all ages. However, for older adults, this beloved citrus fruit may no longer be the healthy option it once was. As we age, our bodies change, digestive sensitivity increases, medication use becomes more common, and tooth enamel begins to thin. Oranges, with their high acidity and potential for drug interactions, can silently contribute to health issues that many seniors may not associate with their daily fruit intake. One of the most common problems among older adults is acid reflux, which affects more than 60% of people over 60. The acidic nature of oranges and orange juice can irritate the esophagus, triggering heartburn, chest discomfort, and even disrupted sleep. Margaret, a 73-year-old from Minnesota, used to start every morning with a glass of fresh orange juice. She thought she was doing something good for her health until she began experiencing severe heartburn at night. Only after her doctor suggested cutting out citrus did her symptoms improve. For many seniors, the muscle at the bottom of the esophagus weakens with age, making it easier for stomach acid to travel upward, especially when acidic fruits are consumed regularly or on an empty stomach. Beyond digestive discomfort, oranges can interfere with over 50 common medications, including blood pressure drugs, cholesterol-lowering statins, and certain antidepressants. Compounds in oranges and orange juice can block or reduce the absorption of these medications, weakening their effectiveness. For seniors who rely on medication to manage chronic conditions, this interaction can be dangerous. The timing of consumption also matters. Eating oranges within 2 hours of taking certain medications can reduce drug efficacy or intensify side effects. There's also a dental risk to consider. As we age, our tooth enamel naturally erodes, becoming thinner and more vulnerable to acid. The constant exposure to the citric acid in oranges can lead to increased tooth sensitivity, enamel damage, and decay. Seniors who enjoy frequent orange slices or citrus drinks may unknowingly be weakening their teeth, resulting in avoidable dental complications. Fortunately, there are safer, equally nutritious alternatives. If you're looking for vitamin C, try red bell peppers, which contain even more vitamin C than oranges but without the acidity. Another great option is kiwi, which provides similar immune-boosting benefits in a gentler form on the stomach and teeth. If you still want to enjoy oranges, follow a few simple guidelines. Never eat them on an empty stomach, as this increases the risk of acid reflux. Dilute orange juice with water at a 1-to-1 ratio to reduce acidity. And most importantly, avoid consuming oranges or orange juice within 2 hours of taking medications, unless advised otherwise by your healthcare provider. Aging doesn't mean giving up the foods you love, it means learning how to adapt and choose wisely. For seniors, understanding how seemingly harmless foods like oranges affect the body can prevent unnecessary discomfort and safeguard long-term health. Making small changes today can lead to greater comfort, better sleep, and more effective medications tomorrow. Avocados. Healthy or hidden risk for seniors. Avocados are often hailed as a superfood, rich in heart-healthy fats, fiber, and essential nutrients. For many people, they represent a healthy lifestyle, whether spread on toast or blended into smoothies. However, for seniors, this creamy green fruit can present unexpected challenges. As we age, our metabolism slows, our bodies process fats differently, and we often take more medications, all factors that can turn this nutritious food into a potential health risk if not consumed mindfully. One of the main concerns for older adults is the high calorie density of avocados. A medium-sized avocado contains around 240 calories, which is a significant amount for someone whose daily caloric needs have declined with age. Seniors who eat avocados regularly, without adjusting for portion size, can slowly gain weight. For those dealing with joint pain, reduced mobility, or heart conditions, even a modest weight increase can worsen symptoms. Robert, a 75-year-old from Denver, experienced this firsthand. By adding avocado toast to his breakfast routine, he unknowingly gained 12 pounds over a few months, which exacerbated his arthritis and made daily tasks more difficult. He thought he was eating healthy but overlooked how calorie-dense this superfood truly is. In addition to weight concerns, avocados can interfere with common medications used by seniors. They are particularly high in vitamin K, which plays a role in blood clotting. This can be dangerous for individuals on blood thinners like warfarin, Coumadin, as it may counteract the drug's effectiveness and increase the risk of blood clots. Similarly, the high potassium content in avocados can be problematic for people with reduced kidney function, a condition affecting nearly 40% of seniors over 65. If the kidneys are unable to filter potassium effectively, excess levels can accumulate in the blood, leading to symptoms such as muscle weakness, irregular heartbeat, and even cardiac arrest. Another surprising issue is avocado allergies, especially among individuals with latex sensitivities. Avocados contain proteins similar to those found in latex, which can trigger allergic reactions such as mouth itching, digestive discomfort, or more severe symptoms like swelling and breathing difficulty. Even seniors who previously tolerated avocados may develop sensitivities over time, so it's important to monitor any new symptoms. Despite these risks, avocados are not entirely off limits. The key lies in moderation and smart substitutions. Seniors can still enjoy the health benefits of healthy fats by incorporating alternatives like olive oil, nuts, such as almonds and walnuts, or seeds into their diet. These options provide similar nutrients with fewer medication interactions and easier portion control. If avocados are consumed, experts recommend limiting intake to 1/4 of an avocado per day, pairing it with protein or fiber-rich foods to enhance satiety and minimize blood sugar spikes. In conclusion, avocados can still be part of a healthy senior diet, but they require careful attention. With slowed metabolism, medication use, and changing nutrient needs, seniors must approach even healthy foods with awareness. A superfood is only super when it supports your unique health needs. By understanding how avocados affect the aging body, seniors can make empowered choices that protect both their well-being and independence. Watermelon, a summer treat with hidden risks for seniors. Watermelon is often seen as the perfect fruit for summer, sweet, hydrating, and low in calories. Its refreshing nature makes it a go-to snack for people of all ages, especially seniors trying to stay cool and hydrated. However, for older adults managing chronic conditions like diabetes, kidney disease, or heart problems, watermelon can bring unexpected health challenges. What seems like a harmless fruit may, in fact, disrupt fluid balance, spike blood sugar levels, and strain aging organs if not eaten carefully. One major concern is watermelon's high glycemic index, GI. Despite being over 90% water, it contains natural sugars that digest rapidly, leading to sudden blood sugar spikes. According to the American Diabetes Association, 2 cups of watermelon can affect blood glucose levels almost as much as a can of soda. This makes it risky for seniors with diabetes or insulin resistance, who already struggle with maintaining stable blood sugar. Betty, a 78-year-old from Arizona, began eating watermelon daily to stay hydrated during a heatwave. Within days, she experienced leg swelling and shortness of breath. Doctors later discovered that excess fluid and sugar from the watermelon were interfering with her heart function, a sobering reminder of how quickly things can go wrong. In addition to sugar spikes, watermelon's high water and potassium content can overload the body's delicate fluid and electrolyte balance. This is especially problematic for seniors taking diuretics or blood pressure medications, which already affect how the body handles water and potassium. If too much potassium accumulates, it can lead to hyperkalemia, a condition that causes muscle weakness, irregular heartbeats, and, in severe cases, heart failure. Since kidney function declines naturally with age, often without obvious symptoms, many seniors are unaware of how easily potassium can build up and become dangerous. Watermelon, though nutritious in moderation, can tip the scales. What's more, excess fluid from high-water fruits like watermelon can worsen edema, swelling, in the legs and ankles and contribute to nighttime urination, interrupting sleep and lowering quality of life. Seniors with congestive heart failure or kidney disease are particularly vulnerable, as their bodies struggle to remove excess fluid. Unfortunately, many seniors turn to watermelon as a healthy snack, unaware of how it can silently tax their systems. So, does this mean seniors must avoid watermelon altogether? Not necessarily. The key is portion control and smart pairing. Instead of a large bowl of watermelon, seniors should limit themselves to about half a cup per serving, and avoid eating it late in the evening when fluid retention can interfere with rest. Pairing it with a protein source like a handful of nuts or a slice of cheese can slow the absorption of sugar, reducing spikes in blood glucose. Even better, consider alternatives like cucumber slices or frozen berries, which provide hydration and nutrients without the sugar overload. Cucumber-infused water, for example, offers a refreshing and low-risk way to stay cool during summer. Melons like cantaloupe or honeydew also offer a safer sweetness in smaller portions. In conclusion, while watermelon is not inherently harmful, it requires caution for seniors. As we age, even healthy foods can have unintended effects due to slower metabolism, weaker kidneys, and medication use. With awareness, moderation, and smart swaps, seniors can still enjoy refreshing fruits while protecting their health and well-being. Papaya, a digestive aid or hidden risk for seniors? Papaya is often celebrated as a digestive superfruit, thanks to an enzyme called papain that helps break down proteins and soothe the stomach. For many people, it's been a go-to natural remedy for constipation or bloating. But for seniors, especially those taking daily medications or dealing with chronic health issues, this tropical fruit may carry more risks than benefits. While its soft texture and natural sweetness make papaya an appealing choice for older adults, it's essential to understand the potential downsides that could quietly disrupt your health. One of the most significant concerns with papaya is its interaction with medications. The FDA has warned that papaya can interfere with blood thinners, diabetes medications, and even some antibiotics. The papain enzyme may enhance the effects of blood thinners like warfarin, raising the risk of internal bleeding and bruising. For seniors who are already at risk for falls and injuries, this can be especially dangerous. In addition, papaya can affect how insulin and diabetes medications are absorbed, causing unpredictable blood sugar swings. Helen, a 71-year-old from San Diego, learned this the hard way after eating papaya daily to help with digestion. Within weeks, her blood sugar levels became erratic, and her blood pressure medication stopped working as effectively. It wasn't until a consultation with her doctor that she discovered papaya was the culprit. Another lesser-known danger is papaya allergies, particularly in seniors with latex sensitivity. Papaya contains proteins similar to latex, which can trigger allergic reactions ranging from mild mouth itching to severe breathing difficulties or even anaphylaxis. While some people may have eaten papaya for years without issue, age-related changes in the immune system can increase allergy risk. Studies show that about 35% of seniors with latex allergies also react to papaya, making it a hidden hazard for those unaware of the connection. Papaya's high acidity can also aggravate digestive issues. Contrary to its popular reputation, while papain can aid digestion for some, seniors with acid reflux, GERD, or sensitive stomachs may find that papaya worsens symptoms. As we age, stomach acid production decreases, and the digestive lining becomes more delicate. What once helped digestion in younger years can now cause bloating, discomfort, or even heartburn in older adults. Many seniors who previously relied on papaya for relief have reported that after age 60, it no longer helps and instead causes more harm than good. So, what are safer alternatives? For digestive support, probiotic-rich foods like plain yogurt or fermented vegetables can promote gut health without interfering with medications. Ginger tea is another excellent option. It's gentle on the stomach and naturally reduces bloating and nausea. These choices provide long-term digestive benefits while minimizing risk. If you still enjoy papaya, moderation and awareness are key. Never eat it on an empty stomach. And always check with your doctor or pharmacist to ensure it won't interfere with your medications. Start with a small portion, just 2 to 3 small pieces, and monitor how your body reacts. In conclusion, while papaya may seem like a harmless and healthy fruit, it holds hidden dangers for seniors, especially those managing medications, allergies, or digestive sensitivities. With thoughtful choices and proper awareness, you can protect your health while still enjoying the benefits of a balanced diet. As we grow older, the choices we make about our health and daily habits carry more weight than ever before. One powerful lesson from the recent content is the importance of awareness and adaptation. The foods and routines that once worked well in our younger years may now need adjustment to suit the changing needs of our aging bodies. This isn't a sign of weakness, it's wisdom. For example, certain fruits, though natural and healthy for some, can quietly cause harm when combined with medications or underlying health conditions. This teaches us a broader truth: what's good isn't always good for everyone. And being informed is an act of self-respect. It reminds us to listen to our bodies, ask questions, and never take health for granted. Growing older isn't just about adding years, it's about living those years with intention, care, and grace. Small, mindful decisions, like choosing the right foods or asking your doctor about a new symptom, can have a lasting impact on quality of life. In the end, aging gracefully means staying curious, adaptable, and most importantly, kind to ourselves, because the goal isn't just to live longer, it's to live better. With clarity, peace, and joy in each day we're given.